Hello, this is Christine. I'm going to be going through a weight loss journey. Going to be getting surgery done since I've tried numerous diets and tried to lose weight and have met with many failures and have not only met failures but have also gained weight back plus some more. And I have chosen to do a gastric bypass or an RNY. Plus, with the numerous things that are going on with me with diabetes, high blood pressure, and quite a few other things that are going on. I was told by one of the girls that's in my doctor's office, that works in my doctor's office, she said to, keep one thing of my clothing, nice piece of clothing that I have that's one of my fat things, or I shouldn't say fat, but, things that I've, worn being overweight, as I am right now. I'm 300 pounds, and I should be losing at least 150 pounds, which is a whole person. I am carrying a whole other person on me. But I was encouraged to try and buy something that I will get into, hopefully, by the time I lose this weight, and then some. Probably, with what I bought, I lose it and then some. The one outfit that I have that's larger, I can pretty well fit into it, but my fanny, my waist is kind of snug in it. So, I'd have to lose a little bit, just a tiny bit, to kind of make it, make it a little bit better. But just to show you, this is the green is the dress that that would be my size, that I'm able to wear now. That is my size. And with the surgery, after the surgery and after I lose all the weight that I need to all the weight that I need, or all the weight, when I have the surgery and I lose the weight and do the exercising and start eating healthier and doing healthier things for myself, and then, try and see about getting into this one. See, big difference. It's almost like half and half. See, it's just half of the size. It's half the size. It's half of the size of this, and this dress stretches out also. So, hopefully within a year to a year and a half time, I will be able to fit into this, and later on you can probably see a picture of me in the green dress first, and then later on we can see me in the fuchsia or mauve, or fuchsia or mauve dress. I don't know what you want to call it, but the green dress I would probably wear for church. This other one, no, probably going out to a nice dinner or going out for the night. But at any rate, this has just been kind of a whirlwind for me, and trying to say goodbye to the foods that I enjoy eating. We'll be saying goodbye to for quite some time. And it's not going to be easy. And I have not been sugar coated or candy coated in any way about this weight loss, about this surgery, that, what the side effects and what's going to happen. So, I chose the RNY because, I wanted to be able to, omit the foods that have been my addiction. That they have to go. They've just got to go. And I've been told that with this also comes that, if you don't have that addiction, that another addiction will come along. One of the people that I know has gone into an alcoholic addiction, pill addiction, and then after that they've gone into using, using their hands, having artistry, doing coloring books and using art with like crayons and crayons and painting and expressing themselves through art. And I'm like, okay, well, that I can handle. I mean, as far as the alcohol and the pills and everything else, or any kind of illicit drugs, no, I don't want to go down that path. I mean, if there's a different path to go down to be addicted to, I'd rather be addicted to, creating, being creative, something to give to the world, instead of, something that's going to destroy my world and destroy everybody else's. So, like I said, this has just been, just dealing with it, and it's like another friend of mine said, it's kind of having a funeral for your food, for the foods that you've been used to eating for so long. And, it's going to be hard to say goodbye. And it's, you're going to have to get used to, having to get used to eating certain things and not being able to eat certain things for 6 months. I love my coffee in the morning, and I won't be able to have that for 6 months at least. And even then, that I can't even have for I can't have for 2 days a week. And even with that, I can only have like a small demi-tasse cup of it, which, is, and I won't be able to drink while eating because it will fill me up faster. So I have to learn to eat like a hobbit, per se. I forget what the meals are. I mean, I'm sure somebody can remind me within the comments. So, but yeah, it would be eating like a hobbit. Yeah, I'm seriously hoping that, with my weight loss journey that I'm going to share with you, I feel like, this is a way for me to have an outlet, that some of you that know what I'm going through will have some positive feedback. For those of you that think this is a cop-out, it really is not. I've, been having to go to my doctor every month to weigh in and to try and, I've been trying to eat better and drink more water and trying to take away a lot of things that have been harming me. I still try to, I've been eating here and there, but, I've gotten under the 300-pound mark, but even though I still consider myself being 300 pounds, because I still don't believe that I'm under 300 pounds. I try to, try to move around as much as possible, try and go out to the mall, because I have friends, I have, good support system that say, come on, we're going to the mall, let's go walk around, let's, try and go do things. I use a Fitbit. I have a water bottle that my hydrate, anything that's going to help, that's going to help. And, you know, I've got a, like I say, I have a really good support system, but, anything that's gonna help at this point. You know, like I said, I would really appreciate that if there's any negative feedback that you please don't, put it on my feed. So, any positive feedback from anybody that's had the surgery, that if you have any tips or anything like that, that if you can, you know, give me some advice for once I get the surgery and when I get home, what am I going to expect? You know, what am I going to have to do to prepare? What kind of foods am I going to have to prepare to eat once I get home? So that I don't come home and I have nothing and I'm going to end up getting sick. So, you know, if anybody has advice, and I'm sure somebody from the doctor's office is going to tell me what I'm going to be needing, but, you know, I always like to be super prepared for things, especially like I've had knee surgery. I had both of my knees replaced, and I'm only 47 years old. So, like I said, if anybody has any words of wisdom, piece of advice, I'm open to that. So, just let me know, and I will probably post something up later on. See where I'm at in a couple of weeks, and hope to get some comments and feedback from you, and talk to you soon.